All right, hello everyone. So today we're going to talk about a pulmonary disease called Hepatopulmonary Syndrome, or also known as HPS. So, HPS, what is it? Basically, it's a liver issue causing a lung issue. It is a progressive disorder, and there are two types. Type 1 is more common, while type 2 is not as common, but both are still pretty bad with the ending. HPS there is a triad that's typically part of this, and it's with liver failure, abnormal arterial oxygenation, and intrapulmonary vascular dilations that cause HPS usually. The symptoms for it is typically short of breath, low oxygen, anxiety periods, cyanosis, increased heart rate, digital clubbing, which is basically like inflammation of the fingers or fingertips, increased nitrogenic oxide levels, and spider nevada. It's and that's with your veins looking like spider webs, basically. So typically, the cause of HPS is still like unknown. There are similar occurrences that seem to cause it amongst the patients who really get it. It's usually since there's an issue with the liver, that's usually cryosis. Usually patients with cryosis get it. It causes other things to happen in the lungs, with having a hard time pumping or dilation of the blood vessels in your lungs. And then there's the arterial oxidation concentration decrease. It's just kind of a combination of everything, but Miller starts with issues with the liver. Another common occurrence is people who have hypoxia, which reduces carbon monoxide diffusion capacity with some patients, but it's not in all of them. According to National Research Council, so with the cardiovascular system, the pulmonary and cardiovascular system work together so they can control blood plasma volume and red blood cells. So say you have a compromised cardiovascular system, the heart usually pumps in and out the blood throughout the body, and so that if there's any issues with that, then that can still make it where there's more lack of oxygen throughout the body, and that causes more the oxygen levels to go low, causing shorter breath, among other issues, but that would be the main one. So it would make breathing even harder than it already is with HPS, which is one of the symptoms that it has. So for testing, there's quite a few you see here, but they're still being researched for some. The main ones that are usually tested is liver function, CT scan, and this is the most interesting one, an echocardiogram. Which usually they have the patient and they put dye within with the echocardiogram just to see how the blood is flowing through the heart, because it causes issues in the heart as well. And so you can see what is called shunting, and it's where there's an issue with the valve that stops blood from just continuously coming through into the heart valves. So it's really cool just to see how the heart is affected with a liver and lung disease by using an echocardiogram with dye. Otherwise, there's the liver function test, pulmonary function test, other tests among here, but this is only limited data that they have so far with testing. Pathophysiology. So typically, again, HPS is rare. There's only partial knowledge of it. What's typical, though, is there's pulmonary vasodilation and hypoxemia within the patient. There's also IPVD, intrapulmonary vascular dilations, and that causes anomalies in the blood oxidation. There's also alveolar arterial gradients of oxygen increase that they noticed too, along with liver cyanosis. Incidences among patients. So, according to NORD, this is between 5 and 32% of patients that have scarring of the liver cyanosis tend to get HPS, which is interesting. Other than that, they don't understand why people get it, but that's a common theme. So economic effects. So this whole PowerPoint here too, this is based off of when a person gets evaluated for HPS until their end time, whatever that is. And I'll explain later why that's very important to note. So according to Roberts, there are 3 types of screenings to determine the cost. And the cost is this is kind of just a baseline that they got from this, but it just depends on other factors like where you live and a bunch of stuff like that. But on average, if you have no screening, the first one shows no screening total costs and life expectancy. Screening with pulse oximetry. Third shows screening with Maria Fatigue Index. With all of them have life expectancies and average cost of it. Usually, life expectancy is between 11 and 12-ish years. And then you can see the incremental cost effectiveness ratio with among the 3 with the life year gained. So it's quite a pricey process, to say the least. For target population, so far anyone is affected. Children, adults, all genders, all ethnic backgrounds. Like, there is no singular population outlier so far. Usually anyone can really get it. Typically, it's within patients, again, who have liver diseases versus other patients. And usually that's people who have liver diseases is between 15 and 20% who get HPS. Just a fun fact, typically animals get HPS more than humans, which I thought was interesting. Prognosis and prevention. Prognosis, very poor. There's really no survival for a long period of time if you have HPS. Usually people who get evaluated and find out they have HPS, they typically have to do checkups 2 to 3 years, and then after the transplant, so this is where the life expectancy slide comes in. Patients, it has to be after the transplant too, because that's been the best result. Patients usually have 2 to 5 years of living. And that's most of the patients. Prevention, it is kind of, they don't know how to really prevent it. An idea would be just make sure your liver is healthy and working. That's not always the case for other people, but just healthy living. Start from there, but it's really hard to see how you prevent it. Their healthy promotion strategies. Basically, these are all trials that they see. Oh, so sorry. Donnie. There are pharmaceutical treatments that have limited data. Some of those examples are antibiotic treatments, nitric oxide antagonists. Those are to improve gas exchange, arterial oxygenation. There's liver transplant, which is very important for HPS, since that has a better way of helping them. There are oxygen supplements, radiological interventional procedures. An interesting study found that the garlic powder capsules, if you have them daily for 6 months, they actually provide really good improvements for arterial oxygenation. But overall, the pharmacological treatments have been less effective than others. Research advances, again, the pharmacological treatments are working towards that. There's investigational therapies, radioactive and other things. The Canadian Hepatopulmonary Syndrome program, they have been working towards researching more of HPS and how to cure it or make treatments better, but they're just limited research advances due to the rare disease and also rare diseases companies. And here are my references. So thank you.